Welcome to Health Talk on Newstalk KGVO, AM 1290 and 101.5 FM with Peter Kristin and John King. Sponsored by Community Medical Center from day one.
Hey, welcome everybody. It is Health Talk, brand new week. And of course, we have the fabulous John King over there. How you doing, John?
I'm great. How are you doing, Peter?
By the way, thank you for filling in for me on Friday.
No problem.
It would have not been good if I'd have been here. Let's just put it this way. The news would have had a special delivery with the acoustics from the restroom.
Yeah.
Which is where I spent most of the time.
There's not a lot of appropriate times to run to the restroom while you're doing the live broadcast in the morning either.
This is very true, yeah. Trust me. We know this sort of thing. But anyway, all that aside, it's kind of a nice little medical story to just kind of jump into what's going on with Health Talk. Poor Dr. Anderson. I didn't want to hear about your stomach flu. Anyway. Well, welcome back.
Oh, thank you. So wonderful to be here. Thanks for inviting me back.
Yeah, good to see you again. Now, I understand that you and I have, you know that whole story of 6 degrees of separation?
That's right.
Right.
That movie, how long ago
was Kevin
that?
Bacon was
I'm
in
with
it.
you. Yep.
Anyway, well, if 6 degrees, any two people can be hooked together within
6 people.
Yeah.
There it is.
Well, you and I, aside from the fact that you're here, you and I have Paul Harvey in common.
Is that right?
Yeah.
Tell me about that.
I want to hear this really cool story. It's written here, and I don't want to give anything away. But when you were a kid, you enlisted the help of Paul Harvey. So what happened?
Well, in a way, I grew up in Bozeman.
Right.
And as a child, I read a book called Nyanuki. And as some people may have read it's a pretty...
Sorry.
I thought you had a different kind of illness last week.
Go ahead. I'm sorry. Nyanuki.
Nyanuki is a pretty popular children's book now, actually. And it's a fascinating story that intertwines with Sacagawea. These two girls were captured and taken to the Mandan, North Dakota area. And as we all know what happened to Sacagawea, she became very famous as a guide for the Lewis and Clark trip west.
Expedition,
However,
right,
yes, her for Nyanuki, who was captured at the same time, Nyanuki wasn't so interested in staying with the Mandan tribe, and she decided she would walk home, and she did, and she was 11. And I thought that story was unbelievably inspiring and amazing, and I really wanted her to be honored. And Sacagawea, I'd climbed Sacagawea Peak many times in Bozeman, and I thought, gosh, that's not very fair that Sacagawea has a peak named after her, and she had all kinds of help, but Nyanuki didn't, so we should name a mountain after her, and we sure did.
So tell me how that came about. I understand you got some help.
I think Paul Harvey sort of summarized the story for us in that, it was one of those things. It's the original, effort that people talk about of getting people interested in grassroots, and we had petitions and things that went to the Survey of Geographic Names, and we petitioned the government to do this, and it's one of those things where if you get enough people involved, then good things happen.
Was there a filibuster or anything? A dramatic
that was
show
next. If there wasn't a story about this, then that was my next step.
No presidential
you
vetoes or
That's
anything?
right. No, I wouldn't have allowed such a thing.
How old were you at the time?
I was 11.
You were 11. So you and Nyanuki were the same age.
Right. And that's part of the interest.
Very cool.
Did they make you walk home from D.C. to show your solidarity?
I would do what it takes. Absolutely. So what is your connection to Paul Harvey? Tell us all about that.
A million billion years ago, back in the 80s, okay. I found my old boss's Rolodex, and we used to air the Paul Harvey broadcast on the station I worked at, right? And so I'm flipping through it, and I see, there's Paul Harvey.
Right.
And it's his office number. And he's always looking for stories.
Absolutely.
So I thought that I would just give him a call.
Oh.
And remember, it's 3:30 in the morning, right?
Yeah.
And I'll get his answering machine and
give him a ring.
Blah blah blah. Yeah. So I dial the number. It's in Chicago, 618 area code, right? Da 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 da. Ring. Paul Harvey.
Oh, you're kidding.
He answered the phone.
Oh my goodness. Oh my goodness. So were you speechless?
I was freaked out.
Yeah.
And I said, Mr. Harvey, I'm so sorry to disturb you. My name is Peter Kristin. I work with KGVO Radio. KGVO? I said, yeah. I was fired from KGVO.
No.
He told me the whole story of how he and Angel This was one of his first jobs here in Missoula. Worked for KGVO radio.
Is that right?
And the owner of the station invited him in and said, "Look, Paul," and he had this kind of man on the street show, right? You got to remember, this is back in the 40s. It's back in the 40s. And he said, "I'm going to do the biggest favor ever. All right, you have a silly sounding voice, and so I'm going to fire you." Because I don't think you don't have a future in this radio business. But you're a great salesman. You should go out and sell furniture or appliances or cars or whatever, and you'll make $1 million. But you're never going to make it in radio.
Wow.
So
that is unbelievable.
So then, and he's relating all this to me, right? So I'm writing it down as quick as I can. And then he and Angel eventually went to Chicago and got started up with a little tiny station because he wanted to do good news.
Right.
That
was the magic.
It was like a 5-minute good news segment, and it grew and grew and finally became syndicated, and then he became, Paul Harvey worldwide star.
Absolutely. Oh, that is amazing. Again, a story of inspiration.
And he and I became close enough.
Is that right?
I wasn't supposed to tell anybody about this while he was still alive.
Oh.
But he and I became close enough. He actually sponsored me in the March of Dimes Walkathon.
Oh, that is fantastic.
I have somewhere in my memorabilia, I have a $25 canceled check from Paul Harvey.
That is fantastic. That is awesome.
Big spender. But anyway, so we have that connection with Mr. Harvey. So.
That is fantastic.
But I know that you're not here just to talk about Nyanuki. You're here to talk about staying safe for the summer, right?
Well, we can, absolutely. It's that time of year where I think we've talked about sunscreen and things like that. Have you been wearing your sunscreen?
I put a dollop on yesterday.
Just a dollop, though.
Well,
okay, we got to revisit.
Is that a precise measurement? I don't know.
Are we going to get with the slop?
It was a gallop.
Tell you what, we're up against our first break.
Oh, okay.
721-1290 is our number. Dr. Kristin Anderson joining us here in studio, and we will be right back with more of Health Talk right after this.
Exciting news! Construction is complete on Valley Solar, and panels are generating electricity.
Hey, we're back on Talkback, and she can groove too, by the way. I want you to know. She's over there dancing. That's all right. We allow that here. John King's over there. I'm Peter Christian. Dr. Kristin Anderson joining us here. I understand they didn't clue me into this, but you would like to have a little bit of a quiz show.
Yeah, I think we should. I think school's out, but I'm going to challenge you guys. Okay.
All right.
So here's the question.
Challenging John and I.
Yeah. Here
What
you
is
go.
the topic?
Amazingly highly educated radio announcers.
I'm not going to tell you the topic. That's part of the fun. Okay.
Okay. I got you. All right.
So I want you to tell me a number. What is the percent of adults aged 20 years and over with obesity?
In U.S. or in the
U.S.
country? Okay.
U.S.
Age 20 and over.
20 and over.
I would say 69%.
I'm going to say 48%.
So we're talking obesity first. You got good guesses, guys. I'm going to ask you a second question, a follow-up question. What is the percent of adults age 20 and over with overweight, including obesity? Different question.
87%.
That's got to be at least 80%.
Okay. So well, good job, you guys.
Right.
So the percentage of adults with obesity is actually 37.9.
Ooh.
Okay. Now, you have to define obesity, first of all.
Well, just I can take a picture and I'll send it for everyone. You can friend me on Facebook if you want.
Okay.
No. Obesity has to do with your BMI, which is over 35. It's a ratio, or 30, excuse me. It's
your
a ratio
body
of
mass index.
That's exactly right, and it's a ratio of height and weight. And it's not a perfect measurement. We can get into how it's not, but there are things that are just ballpark measurements, and there are exceptions. And absolutely, sometimes you get a pass, but overall, that's our numbers, 37.9%. So the ones with overweight and obesity, you're very close. The number is actually 70.7%.
Ooh.
Now that's got to scare the heck out of the healthcare industry.
I think it's terrifying, and I think
they're probably raking
in
the money on this.
That was the thing
Maybe
I
the
was not going to
swimsuit
say.
industry.
Yeah.
But we that is exactly why I think some things are changing in the healthcare industry. We need to address this. I mean, it's terrifying as a country. We need to look at that and deal with that. Absolutely.
Okay, I realize we're talking to adults. Who are out there,
Right.
our primary audience, 25 to 54, or whatever it is. I don't know. But these are people who are adults. They're able to make their own decisions.
They are.
They go to the store. They can either buy fruit and vegetables, or they can buy Fritos. They can eat nice lean meats, or eat nothing but bacon on everything.
That's right.
So how do you convince people? I mean, not really very obese, just sort of kind of obese, just I guess acceptably obese. How do you convince them to knock it off and start getting healthy?
Well, if someone has the answer, we'd love to know it, because I don't think there is a good answer.
You can't force them, obviously, right?
No, but I think this is one of those things where your doctor can have a conversation with you about it, and then if you start to see, gosh, I can't do the things that are fun anymore, you got to link it back to you and your family, and see that connection between obesity and, say, heart disease, cancer, stroke. Obesity is a risk factor for these things. And so you've got to make that decision. Is it important to you?
Well, when it comes to obesity, what seems to play a bigger role in the cause of obesity in Americans? Is it more just sedentary lifestyles or more overeating? I know the answer is both, but...
Right. It's a good question. I think one line that I think about a lot and talk to people about is you can't outrun bad nutrition. So physical activity is tremendously important, and we can talk about that. That's a whole nother show, honestly. But nutrition is critically important. And, there are a lot of factors that go into that, including going to the grocery store and making choices. And if you choose vegetables and fruits, it gets complicated. It's one thing to say that, but how do you store it? How do you prepare it? Those are complicated things and not something to sneeze at. And I don't think people necessarily do that as much as they used to anymore. They're in a rush. They're hungry. I think there are some cost factors that come into play. You can go to a fast food restaurant and get some nutrition that isn't so good for you, but it fills you up. Does it give you the nutrition you need? Probably not.
Right. Now, I have heard, and you can tell me if you can explode this myth if you want to, that when you go into the average grocery store, you should never go into the center of the store where all the processed foods are. You should shop around the edges where the fruits and vegetables, the dairy, except the deli.
Sure.
Well, with
the
all
fatty
those,
meats are, and cheeses.
Yeah.
Right.
So yeah.
I think that's really good advice. I think trying to eat, the fruits and vegetables that are right there in front of you that look appealing. That's exactly what you should be doing. So here's question number 2. Question number 2. You ready? So
by the way, did we win or lose? Because we both went over. Is this
I
Price of Right rules?
Intrigued by that. Yeah.
So, John,
it's a dark, scary world
we're
here.
We're pessimistic, I guess.
Radio station.
We're losers here. So go ahead. Yeah.
All right. So if you have a 2,000 calorie diet, how many cups of fruit should you eat every day?
A 2,000 calorie per day.
This is just a ballpark. You can pick the.
My guess is 8 cups.
8 cups. Do you eat 8 cups of fruit?
8 cups of fruit?
8 cups of fruit.
Oh, is it fruit and vegetable? I'm sorry.
No, just fruit.
Just fruit. Okay.
Yeah,
I would
you
say
are shooting for an A+ for today. That is.
I eat a lot of fruit, but I don't think I eat 8 cups of fruit. I probably would say 4 cups of fruit.
Okay.
Don't look at me.
No. Oh, are you not a fruit eater?
Well, if fruit,
I eat 8
just
cups
pretend
of,
it's Fruit Loops, Peter.
I eat 8 cups of fruit in a year. Okay.
Oh, well, intervention number 1 right here.
I am the Cheetos and Dr. Pepper kid. Okay. I'm terrible. And look at me. My weight is good. My cholesterol's 160.
I only took a day off of work 3 days ago.
That's right.
Because I was sick.
Had nothing to do with nutrition. Had nothing to do with nutrition, pal.
Oh.
But anyway, my blood pressure is
vitamins and minerals.
My blood pressure is 110/60. So
there you go.
What am I doing wrong?
No. Well,
slap me around. I don't want him here next time.
That's right. Well, how many vegetables should you eat a day?
How much should you eat a day?
Yeah. For this same 2,000 calorie diet, this is big.
Are we talking cups?
Cups.
Okay.
I would say 8.
I'm going to say 4.
A+, guys. But so it's actually about 2 cups of fruit a day and 2.5 cups of vegetables a day. Now, if you are eating that is impressive. That is a lot of food prep, and I am impressed. So congratulations. I think that's
we just
awesome.
leave a giant bowl of fruit out on the counter, and fruit and nuts are the kind of the free thing if the kids are hungry before a meal. So. But yeah, I throw open a mandarin orange.
There is a joke just waiting for the fruits and nuts deal. Anyway,
that should be our teamwork name.
I know.
Fruit and nuts.
We're going to come right back with more. We'd love to have your comments. You can join in with us on the hilarity. We'll be right back with more of Talk back in a moment. Hey, we're back. This is Health Talk right here on KGVO, 1290 AM, 101.5 FM. John King, I'm Peter Christian. Dr. Kristin Anderson joining us here this morning. And we're talking about nutrition. And, hopefully you have not, voted me off the island yet.
For the Chips Ahoy and Cheetos.
Okay,
so we did get some questions for you from a bunch of listeners about types of diets or things to maybe be obese. So I'll throw these out. Katie says, she mentioned go low carb, paleo, cut out sugars, or how about periodic fasting? So those are 4 options she threw out there.
I think that's a great question, Katie. Thanks for bringing that up. There are all kinds of diets that people talk about, and you can look online, but I think whatever you choose, whatever you choose, you want to make sure that it's sustainable and something that you plan to do lifelong. And so if you're looking, I really would recommend their websites, choosemyplate.gov, that has very tailored information. You can even put how many calories you think you need, or your physical activity level and some basic measurements, and then it will actually give you a diet. And so focus on, I would suggest that you focus on things that are sustainable and healthy and probably something that you can do lifelong.
Now, when you say sustainable, you mean something you can actually stick with and do.
Yeah, because it's awfully hard to go out to dinner with your friends and sometimes order something that, makes no sense in the restaurant or things like that. You want to be able to do things where you're making healthy choices and also it makes sense. I mean, you don't want to go and have to bring your own shake or something like that because a big part of eating is social. So I think we need to learn to live sort of in the environment that we're in and instead of, trying to make up fad diets.
It is also helpful to have friends who are supportive, right?
Absolutely. So I think you've probably talked about it on the show that obesity, there are some studies that it's contagious. So the more that you're around people that are obese, the more likely it is that you are. And that gets into, again, the public health piece of, how we live doesn't have to do with just that 2-second interaction with your doc.
Whoa, wait. Why do you think it's contagious in the sense that, like, you could, like, let your guard down, like, maybe they're this fat, I can be up to that fat. I don't have to go fatter, but, this is kind of the range where I feel comfortable. Like, sweatpants day for me is okay.
Well, in some ways, kind of yes. I think that I'm assuming that we all can recognize that if we went back 50 years, these weren't the statistics that were the case in the U.S. And so when you do start to look at the progression of obesity like anything else, it's an increasing trend. And you do start to feel comfortable with the people that you're around. And so just as you say, you want to be supportive of family and friends and maybe take on some healthy activities.
There are folks and organizations out there who are claiming that the food that we're eating right now is not nutritionally sufficient. And so we end up eating more and more to feel full. Have you found that to be true or
well,
not?
One of the things that I wanted to highlight for the summer, especially in Missoula, is that we have so many options. You've got the farmer's market to go to. You have, the option to, maybe do a garden or go work with Garden City Harvest and get your own plot. So you can grow your own food. There's a tremendous amount of healthy food that's available to us that we're lucky to have that doesn't exist everywhere. So to take advantage of those wonderful opportunities.
Dr. Anderson, we have like less than a minute. So give us some contact information how we can get a hold of you gave a website not long ago about diets.
Let me give that again. So that's choosemyplate.gov, and that has a lot of good, trusted information about healthy diet, and we can get onto physical activity if you want to on that website. And then also, if you do have questions, sometimes it's a conversation with your doctor that makes the difference. So communitymed.org is a great place to go if you want to look for a primary care provider or make an appointment.
All right, that's 728-4100. I got it. See, I got it now. All right. Dr. Anderson, thank you so much.
Thank you.
It's always a delight having you on.
Oh, thank you so much.
All right. And thank you for putting up with us and our silliness and Chips Ahoy.
Enjoy your summer.
Yeah. Cheetos.